rapid access to comprehensive oncology data and survival analysis. This is the OncoToolkit.
Hi everyone. Earlier today, I met a patient in clinic who had recently undergone surgery for breast cancer. She asked a very practical question. Do I really need chemotherapy, or could endocrine therapy alone be enough? It's a common question in clinical practice, and one where risk assessment tools can be particularly helpful. Let's take a closer look. Here's a brief overview of the patient. She is a 55-year-old woman with early invasive breast cancer. The tumor measures 22 millimeters and is classified as grade 2. One lymph node is positive. The cancer is estrogen receptor positive, HER, 2 negative, and KI, 67 positive. The tumor was detected after she developed symptoms rather than through routine screening. At first glance, this isn't an obviously low-risk or high-risk case. Let's use the PREDICT Breast Prognostic Index to help put these factors into context. We'll start by entering the patient's age. She is 55 years old. Next, we'll enter the tumor size, which is 22 millimeters. One lymph node is involved, so we'll enter one positive node. The tumor is grade 2. Estrogen receptor status is positive. HER, 2 status is negative. KI, 67 status is positive. Finally, we'll select symptomatic detection. Everything looks good. Now let's calculate the score. Here are the results. The prognostic index combines several important clinical and pathological factors into a single structured assessment. Rather than focusing on one variable alone, it helps provide a broader picture of the patient's overall prognostic profile. For patients like this, the result can support discussions about adjuvant treatment options and help guide multidisciplinary decision-making. Of course, the score should always be interpreted alongside clinical judgment, current guidelines, and patient preferences. If you'd like to use the result elsewhere, you can quickly copy the assessment as plain text and paste it into your own document. You can also save the assessment within the platform for future reference. Saved cases can be reviewed later from the Saved Results panel. If needed, saved results can also be downloaded as a CSV file for local storage on your own computer. If we scroll down, you'll find additional reference information, clinical context, and supporting evidence related to the scoring system. These resources can help clinicians better understand how the result fits into the broader treatment planning process. If you found this video helpful, please like and subscribe for more oncology decision support tutorials. You can also explore additional oncology calculators and clinical tools on OncoToolkit. Thanks for watching. We'll see you in the next case.